months ago, a family member was in the hospital and called me, quite upset, saying his PCP hadn't been by to see him since he was admitted. For a moment, I didn't even really understand what he was talking about. Then I somewhat sheepishly replied, "We don't really do that anymore." The reason we don't do that anymore is that now we have hospitalists. The number of hospitalists has been growing dramatically over time as outpatient offices have gotten busier and more complex, leaving PCPs with little time to make rounds on the local wards. But this state of affairs leads to an interesting question. Would your primary care provider, someone who knows the ins and outs of your medical history, or a hospitalist, someone who knows the ins and outs of a complex healthcare behemoth, treat you better when you're hospitalized? That's the question that this article appearing in JAMA Internal Medicine attempts to answer. The researchers used Medicare data to identify 650,651 older adults with a hospitalization in the U.S. in the year 2013. Based on billing records, they determined if the primary physician caring for the patient was a hospitalist, the patient's own PCP, or an other generalist. That third category were basically non-hospitalists who also didn't have a prior relationship with the patient, potentially cross-covering outpatient docs. After accounting for severity of illness, hospital factors, patient comorbidities, and diagnosis-related groups, some really interesting results emerged. I'll start with the big finding. 30-day mortality was 10.8% among those cared for by a hospitalist, compared to 8.6% among those cared for by their own PCP, a small but significant difference. If this difference were true and causal, that means that there is one excess death for every 50 patients treated by a hospitalist, and that could add up quickly. But is it causal? I spoke with Dr. Jennifer Stevens, the study's lead author, to get to the bottom of it.
You would expect if this was all unmeasured confounding that the readmission findings might be different.
What she's pointing out is that if hospitalists just take care of sicker patients than PCPs, wouldn't the readmission rate be higher for the hospitalists? But to be fair, she also cautioned me that these results haven't been replicated and should only be hypothesis generating. But I think it's likely that there's some value in knowing your patient well. There's some value in knowing the hospital well too. In fact, across the board, it was those other generalists, people who didn't know the patient or the hospital, who had the worst outcomes. Dr. Stevens believes that some patients might need that special relationship that comes from a PCP.
There might be some populations of patients who would particularly benefit from that level of familiarity. Maybe they're the very old, or maybe they're the patients with complex clinical condition.
Hospitalists are here to stay, and I, for one, am very thankful for the hard work they do. But perhaps finding small ways to integrate PCP care into a hospital stay might change the dynamic for the better. Your move, Skype. For MedPage Today, I'm Perry Wilson.